Welcome, Brooke. I'm so glad that you're able to join me today. I want to introduce you first, but how has your morning been?
It's been very busy.
Oh,
Um,
yeah.
yeah, here at the clinic, like I've just been doing a ton of marketing, so answering emails, going out and about,
Oh,
rushing here, rushing there. So I'm
yeah.
getting
Marketing
there.
is a whole job in itself.
I know.
So, before we get started, I want to introduce you. This is Brooke Baker. She is a pelvic floor therapist and works at Origin, based out of San Antonio, Texas. She's a mom to a rambunctious 17-month-old, and her perfectionism in her career and personal life really began to butt heads once she became a mom, and something had to give. And dealing with her own postpartum struggles really complicated her ability to balance all of these responsibilities. And speaking of balance, Brooke, what is your definition of a balanced life?
So first, I just want to say thank you for having me. This is really
Yes.
exciting. I'm excited to be able to talk about my motherhood journey. Hopefully, it will
Mm,
help some mothers out there to kind of help find resources, and maybe my definition of balance will be helpful. I don't know. Um,
yeah.
so, so for me, I feel like my definition has very much changed since I've become a mom. If you'd asked me 3 years ago what the definition was, it would have been completely different. For me now, being a mom, being a full, like working full time as a pelvic floor
Mm,
therapist, and then, of course, trying to be healthy and do all the things, I would say that I've learned through my postpartum experience, really,
mm,
that I kind of had to let go of control of a lot of things. And so for me, balance means kind of just going with the flow as much as you can, accepting things as they come, and realizing that you can put however much energy you want into each bucket. And it doesn't have to be 100% in one versus the other. It doesn't even have to be a set
mm.
percentage. It can just be today, I want to put, some energy here, some energy there.
Yeah,
It can be fluid. It can change. It doesn't have to stay the same. And I think that that is
absolutely.
the biggest thing I've taken away from this motherhood thing is you kind of just have to let things go. Yeah.
Hmm. Yeah, I mean, because I've seen it even in myself and with other moms and other women that I've worked with, is the belief of balance is like giving equal percent of yourself to everything, and that's just impossible. So I love that you brought up that you get to choose how much of your energy and your time that you're giving to these specific things. And those, that can change based on whatever is going on in your life.
Absolutely.
At what point did you realize that your definition needed to change? Like what like was your light bulb moment?
So for me, I had a pretty rough postpartum journey. I was dealing with depression, anxiety, and rage all
Mm,
at the very beginning. That after going to talk therapy, I they helped me understand that a lot of my feelings were centered around like my issues with breastfeeding. I was having a hard time with
mm,
that because, again, I was a perfectionist and this is what I chose that I wanted to do. And so struggling
yeah.
through that. And then, of course, all of the other struggles as well. But realizing that anxiety stemmed from, or at least this is what my therapist told me, was
Mhm.
usually stemming from my needing to control things. And
Okay.
so kind of relinquishing control over things
Mm,
has so anyways, beginning of my postpartum journey really early on, I think I started going to talk therapy like week 2 because I was in a really bad
okay.
place. And so definitely then is when it was very early that I realized
Mm,
that I needed to transition my way of thinking. And once I
yeah,
did that, honestly, like so many things opened up for me emotionally, just a lot more space for things in my mind.
that's awesome.
Yeah.
And thank you for sharing that. I know like sharing about postpartum journeys can be really difficult because it puts us in a vulnerable place, admitting that we
Mhm.
were not maybe living the way we wanted to, and it being because of the way we were looking at ourselves and
Yeah.
what we thought that we had to give as moms. Yeah.
And going back to kind of who I was as a person before, again, perfectionist, like I wanted to portray that I had my life together all the time. So being vulnerable, that wasn't like something that I did, unless it was
Okay.
with somebody
Yeah.
that I really felt close to. And I don't trust that many people in my life, even still, I think. But I think that postpartum journey and becoming a mom, I mean,
Mhm.
there's no more vulnerable experience I think you can have in
No,
life.
there isn't.
I mean,
Yeah.
so yeah, it was kind of like my therapist was like, babies are basically, they just get like, they're like little bombs that get dropped into your life and then control goes out the window.
Yeah. Oh my gosh, that's such a funny, what is it? What is it called? Like image. Um, because they are, babies are just like drops in your life. And no matter how prepared you are, no matter how many books you've read, it's always like, oh my gosh, what am I doing?
Yeah.
Even if you have multiple children, I have 3 kids, and each one of them, although it did feel like a slightly bit easier, was just like, oh my gosh, what am I doing? How am I going to navigate this now that I have not just one, but two, and then again 3?
Yeah.
So
I
it's
have not gotten
always
that far yet,
yeah. But yeah, it does feel like a bomb. Yeah.
and I'm sure your definition of balance changes with each one.
Yeah, it does. And it did. Yeah.
Yeah.
And so after you were talking about how she said it was this bomb and that you had to relinquish control, what, how did you get yourself to do that?
I think honestly, like it's something that I knew even before I had a kid that I was dealing with some level of anxiety at all times. And then of course depression was always pretty situational for me. Going through grad school was really tough, but just realizing that like once I started talk therapy and after feeling like I mean, even just after the first 2 sessions, it was like a huge weight
Mm,
was lifted off my shoulders because it was like,
yeah.
okay, someone hears me, someone understands me. I'm not as crazy as I think I am. So it allowed
Yeah.
me to be vulnerable. And so with her at least. So her making me realize that most of the issues that I was experiencing had to do with the way I was thinking and processing things is how I was able to do that. So again, pretty early on, and it was not like a complete 180. It did my feelings were like a complete 180. It was a very empowering experience. I was like, wow,
That's
relinquishing control
awesome.
actually gave me more control over the way I feel, you know.
Yeah.
It was a choice that I could make and I was able to okay, go with the flow. I feel and I would feel so much better than like being upset that something didn't go the way that I had planned or feeling out of control.
Yeah.
Yeah.
Man, you brought up a lot of like amazing points. One being that because you had brought up like you dealt with like situational depression and anxiety was you felt like was always kind of part of your life. And a lot of people don't realize that those things kind of come hand in hand, especially when you are dealing with perfectionism or see yourself as needing to be a perfectionist because you get so anxious that maybe things start to pile up. And then because things start to pile up, you start becoming depressed because you can't get to those things that you want to do. So it's almost like cyclical and they come hand in hand together. And it's not that you will only have one or the other. You can have them at the same time.
Mm-hmm.
Yeah.
Yeah.
And then the other point that I want to highlight too is that it wasn't a 180. And when we're working through these things, it's never going to be a 180 because these are patterns that we've built throughout our lifetime. And but going into like therapy sessions will be helpful if you go in there with an open mind and willing to bring up this stuff, like willing to trust your therapist and build that connection with them so that you can work through these things. Because it sounded like it really did work for you pretty
Mm-hmm.
early on.
Yeah, I was going to say something off of that. Going to talk therapy was helpful for me because I knew I was also dealing with rage, postpartum rage, and I'd always had anger issues, I think, kind of throughout my life,
Okay.
but just exemplified, obviously, with the
Mhm.
hormonal things that were happening postpartum. So going in and like finding out what my triggers were so that I knew kind of either how to avoid or recognize, and so that I could like stop for a second and think was really helpful. And it was really helpful to sit down in front of somebody and have it like be kind of a guided session and an
Yeah.
unbiased person too was really helpful because like your mind is just like going and it's all over the
Yeah.
place. And so you know like what you should do and but it's really helpful to have somebody else that maybe isn't going through exactly what you're going through in that
Mhm.
moment, and they can kind of slow things down for you and like, I don't know, make it more linear, I guess, or
Yeah.
just breaking
Mhm.
things down. It really helped a lot.
Yeah, absolutely. And that was another thing too. You had mentioned like you didn't feel like you could really trust anyone. And when people feel that way, that is one thing you can work on in therapy is building your trust with your therapist was going to help you learn to trust the other people in your life. And it sounds like that's exactly what happened for you. Being able to trust her, let you be able to be vulnerable in the office and like let her know or him know the things that you worked on that you needed to work on, and they were able to help you through those things.
Mm-hmm. Yeah,
Yeah.
definitely.
So again, I really appreciate you opening up, especially about like the anchor stuff. It can be embarrassing, like admitting some of
Mhm.
these things.
Yeah.
But when we talk about these out in the open, it just makes it easier to swallow that we've done these things because I've had my own like run-ins with anger. I'm embarrassed to talk about it sometimes. Like
Mm-hmm.
one time this was after I had given birth too. My son was maybe a year old and I was trying to fix this old printer that I had from college and I could not. And I just got so mad. I went outside and threw it. Like I threw it off our porch. I came inside and my husband looked at me like, well, he was not my husband at the time. He was my boyfriend. He was like, what happened? Are you okay? I'm like, no, I'm not okay. And so that was a huge moment for me where like I cannot do that. Like that's not okay. I need to figure out how to manage this because
Mm-hmm.
I can't throw other things in other places. Luckily, like it ended up being fine. I didn't need the printer. It was broken. It was from college, so it was super old. But yeah, those things, when we talk about these things, we can get through them, like as women going through these struggles. Because
Mm-hmm.
when we bury these and hide them, then they just fester within ourselves.
Yeah, and I mean, you can get away with that for so long. Like, again, before I was a
Mhm.
mom, it was like, okay, my husband, he was supportive. He didn't always like the way I was reacting to things, but he wasn't really saying much. He was just kind of always
Mm,
there to support me. But when you have a kid, it's so different. You're like, this little human is watching every single thing I do.
yes.
I need to figure out how to emotionally regulate so that I
Mm,
can teach another human how to do the same because that was honestly like once I got through the initial, like,
mhm.
I need help, like, I'm going off a cliff,
Yeah.
once I got through that initial experience, it was more, it transitioned more from the postpartum into more like working on me as a person
Mm,
and kind of things that I should have been working on before I became a mom. And
yeah.
so, yeah.
That's awesome. Yeah. I mean, therapy does that, right? You go in for one
Mhm.
thing and then you realize, oh, I probably should work on this too. Yeah.
Yeah. Hmm.
And if you have a great therapist, that will happen. Like
You can do
that is
that.
going to be
Mhm.
something to experience because it's usually not the one issue you're going through. There's usually a root issue that needs to be worked through. Yeah.
Right. Again, it's sometimes it's those moments where you're like, okay, I'm just putting that under the rug for another time. And then
Yeah.
eventually you've done that so much that you finally just need to
Oh,
do.
yeah.
Hmm.
Yeah. So tell me more or tell us more, right? Tell us more about your work in pelvic floor therapy because I know that that's something it's still becoming, I guess, not popular, but known. Like
Hmm.
I feel like there's still a lot of women who don't really know what going to a pelvic floor therapist can help with because at least for me, I've never been given a recommendation for a pelvic floor therapist. I mean, I don't even know if I would have needed to, but one thing I had recently found out it's not normal to pee a little bit after you give birth, but
Yeah.
that it's very common.
Yes. Yes. So, kind of a little background on like what I do and how I got here. So, I am a physical therapist. I knew probably since like high school that I was interested in the pelvic floor.
Okay.
Not to say that I knew exactly all there was to know about it.
Yeah.
I was also in that category of like, oh yeah, just do Kegels. Not true, by the way. Found that out later. So I did a rotation in grad school, and then I didn't want to dive right into a niche right away. So I did acute care. So I worked in the hospital when I first graduated. And then when I got pregnant with my son, acute care became very hard on my body. It was really hard to lift people out of the bed as I got more
Okay.
pregnant. And I was like, well, this is the best time, I guess, to make that transition. So now I'm here. I've been doing pelvic floor therapy for about 2 years now. And so I feel like the biggest thing that we love is educating and awareness about the pelvic floor. What is it? What symptoms to look out for? Why is it important? So, I mean, specifically to moms, of course, like your body
Yeah.
goes through, I mean, not that we like to think of, pregnancy and childbirth as trauma, but it's kind of traumatic to your
Oh
body.
yeah. I would say that it's trauma within your body. Like your body is going through a very big event. So I think that's an absolutely perfect word to use.
Yeah. So, we love to see moms while they're pregnant, even before they're thinking of getting pregnant, just to get screened. A lot of it is just like education on body mechanics and pressure management. And then we do a lot of birth prep here as well, especially if your goal is to have a vaginal birth. We help kind of prep the tissues and go through positioning for different laboring and delivering positions. So that's really nice. That's kind of more in the preparatory phase, preventative phase.
Yeah.
So you can look at it that way as well. Postpartum, a lot of things that moms tend to experience: constipation, bladder leakage, prolapse, obviously aches and pains because they just had this big belly and now it's gone and their body's adjusting. So there's all kinds of different things that they could experience. And I would say, again, common, but not normal. It's something that a lot of women will just live with because they've heard, oh, that's normal after you have a baby. And, you have this child and you're so happy to have them that you're like, oh, it's fine. Like, well, you're busy for one. So you're like, well, I don't have time to address that anyways. But also you're like, yes, you destroyed my pelvic floor, but I love you so much. And that's just what it is,
Yeah. Yeah.
And it doesn't have to be true. So we love to see moms postpartum to address any concerns. Another one that's very common is painful intercourse, especially if you had tearing or some kind of other complication in birth. It's definitely helpful to get assessed for that because yes, I would say it's probably pretty normal to be a little uncomfortable when you're at your 6 week mark, right? Like things are still healing.
Oh
But
yeah.
like
Yeah.
after that, if you're still experiencing some discomfort, pain, even just weird sensations, maybe you're not able to reach orgasm either. Maybe it feels different. Maybe it's not just painful, but it feels different and it's not the same. Those are things that we can address too. Yeah.
Oh, that's really good to know. Yeah. So at what point would someone be like, I should probably see a pelvic floor therapist? So you
So
had mentioned like it's not normal like to
mhm.
pee. So if you're like peeing a little bit after pregnancy, like that's probably a sign. And then also like the pain during intercourse. Are there other like signs that I should probably see a pelvic floor therapist? Like this is something that they can help me with versus going to another provider?
Yeah. So another thing we see commonly is like vaginal dryness, especially with the hormonal changes and in breastfeeding, especially. Again, I mentioned like constipation, but also like abdominal separation. So if you're feeling like that weakness in your core or you're noticing that doming when you go to do like a sit up, you're getting in and out of bed. That is another thing that we definitely want to address to limit, a hernia in the future. And again, teach better pressure management to avoid those things in the meantime.
Okay. And
Yeah.
that's called what? Diastasis?
Diastasis recti. Yeah.
Okay, okay. I was
DRA
like,
for
I
short.
think I say it wrong. I think I say it wrong.
Yeah. Diastasis recti or DRA for short.
Okay.
Yeah, so to answer your question about when should someone see a pelvic floor therapist, if it's not surrounding birth or pregnancy, I would say really there's no wrong answer. If you're having issues with bowels,
Okay.
constipation, leakage, not being able to hold back gas, those things aren't normal,
Okay.
especially if you like to exercise, right? People are like, yeah, I leak, but only when I'm jumping or, and I might fart during an exercise, but that's normal. No, it doesn't have to be normal. Um,
Okay. Yeah.
so,
Yeah.
So that kind of stuff. But specifically with postpartum moms, we would love to see like doctors start to make it a part of
Mhm.
their routine plan of care and kind of standardize it. Hey, you just had a baby. I want you to go see a pelvic floor therapist. And that's not to say
Mhm.
that you're always going to be a perfect candidate, but it
Yeah.
allows us to assess, the whole body, and we take everything into consideration. We're physical therapists, right? So we look at
Yeah.
everything, but we do specialize in the pelvic floor. So,
Mhm.
it could be anything that's contributing to any of the symptoms that they're experiencing. So we like to look at everything. So we would love to see anyone postpartum just to kind of screen them and see, okay, and if they're fine, that's great, right?
Oh yeah. I mean, I agree. Like it it would be awesome because the doctors aren't really looking at those things, or they might not know what to look for. So just
Mhm.
having this even if it's preventative, right? Instead of waiting till later when things are more of a problem that y'all could catch.
Right. Yeah, absolutely. And I mean, I also kind of want to mention some of these other countries, like the European
Mhm.
countries, it is standard of care. They're
Wow.
getting sent to a pelvic floor therapist after every birth.
Wow. That's
Yeah.
crazy. It always
And
blows my mind, even though I know that we're usually behind on caring for moms and caring for women, and I hate it. But that's why I really wanted to have you on because
yeah.
this is something people like, this is something moms and women need to hear about.
hmm Well, and we kind of talked about it before. The company that I'm working with now is
Mhm.
Origin, and it's a woman-owned established company. It was two women who were dealing with their
Mm.
own pelvic floor dysfunction, one after giving birth, and then the other had been dealing with painful intercourse for I think about 10 years
Oh
before. And
my gosh.
she was going
Yeah.
doctor to doctor to doctor, and nobody was helping her. And so her friend, so they were friends who had just had
Okay.
the baby, she was like, okay, my husband has a painful shoulder and he's getting better care than I am after
Mm.
going through this very traumatic birthing experience. And so she found a pelvic floor therapist. Things went really well, and they were like, okay, why did I not know about this sooner? This could have saved me so much time and struggle.
Yeah.
And so
Hmm.
they came together and they were like, okay, we need to increase access and awareness to women and those with vaginal anatomy across all of the US. So that's their mission and that's what they're doing. They're expanding now into all the
That's
different
amazing.
states and stuff. Yeah. So
Do you know off the top of your head, or if you have information like in front of you, what states Origin's located in?
yeah, so they're out of California. Then they came here to Texas. So they're in Austin, San Antonio, now Houston. They
Okay.
just opened up in Atlanta. They are in
Mm.
so Georgia, and then they just opened up in Portland, Oregon.
Oh, that's amazing. That just means that the word is spreading about the importance of pelvic floor health too.
Yeah, absolutely. And then I'd also like to mention too, they offer virtual care across the nation. So there are certain things that you don't
Mhm.
always have to have hands on. Sometimes
Okay.
what we see is a lot of education and building awareness. Of course, we would love to see you in person and get hands on,
Yeah.
and maybe that's something you plan for eventually. But sometimes it's just nice to do a check in and have
Mm.
someone to talk to and some guidance, which is especially helpful postpartum. And they
Okay.
do have a 6-week postpartum care program that
Awesome.
is specific to postpartum moms, and we can see them early. Like, again, we don't do hands-on or internal assessments until at least 6 weeks or they've been cleared by their doctor. But if they're wanting
Okay.
like earlier support, I mean, as early as 2 weeks, they can get on
Mhm.
with a virtual therapist and just get gentle guidance, gentle
Okay.
exercises to start to recoup.
Mhm.
So that's helpful. And they can always transition at any time. They can go back and forth. They can do a
Okay.
hybrid of virtual and in person. So depending on where they live, if that
Mm.
option is available, of course.
Okay. So are there certain things that would be like more appropriate, or not more appropriate, but like it would be okay for someone to reach out for virtual appointments?
Honestly, really anything.
Okay.
Because again, a lot of it is education. So, I mean, even, they see a lot of like the diastasis recti they can see online. I mean, there's a
Okay.
lot of
That's
different things.
true. Yeah. With video.
Yeah.
It's very
And
obvious if you have the diastasis recti. It's very obvious.
Yeah, and they talk you through, I mean, You can do a self-assessment of your pelvic floor muscles. They talk you through that. They can have you go through a self-assessment of your abdominals. And so if at any time they feel like it is beyond what they can manage virtually, they help locate somewhere for you to conveniently go in person to follow up.
Oh,
Yeah.
so that's awesome. So it's not just like a place where you can get treatment, but if there is not an origin in your area and they can't treat you virtually, they're going to take the time to give you a referral to someone near you.
Yeah, we are, we know therapists kind of all over. So I would hope that whoever you're seeing virtually
Yeah,
is going to help you find someone close to you. Yeah.
that's awesome. Yeah. Are y'all a smaller group, like pelvic floor therapists? Is there still like not that many of y'all?
Yeah, oh, where did I see that? They actually had statistics. Origin did. What did they put that on? Geez, you're asking hard questions now. No, there are definitely like there is a huge need for pelvic floor therapists everywhere, right? That's one reason why they went big with the virtual. That was one of
Okay.
the reasons why they did virtual is because their mission was to increase access to care.
Yeah.
All of their locations are in these big markets, right? Like all these big cities. But what about all the
Yeah.
other people who are hours
Yeah.
outside of
hmm
these big
Yeah.
cities? And so, for example, I have a patient right now who travels 2.5 hours to see me. So I'm working in virtual appointments with her that I feel, if it's going to be a lot of talking or I'm going to be doing a lot of demonstration, then I will have her in the comfort of her home and not having to drive a 5 hour
Yeah.
round trip to see me.
Yeah. No, I get it. I mean, where I am from, to my knowledge, I do not believe that there is anyone that's a pelvic floor therapist here. I'm in Del Rio, Texas, so it's a small rural town, and it is 2.5 hours away from San Antonio. So that would be, if someone here wanted to do that, they would be driving that far.
Yeah.
So we'll throw that number into the show notes along with like the information on how to get in contact with you and other Origin offices in the area.
That sounds perfect. Yeah.
Yeah. So you said that when you were in high school, that's when you were intrigued by the pelvic floor. What intrigued you about it?
Okay, so I actually really wanted to be like an OB-GYN. Um,
Okay.
because I loved reproductive health. I thought it
Mm,
was so interesting how like the women's body can do what it can do.
yeah,
And then
it is amazing.
I also had an interest in like just sexual like health
Mm,
in general. So I was
okay.
like, perfect, like those can go hand in hand. But then I realized I didn't want to go to school for, 12 to 15 years. And I knew I
Yeah.
wanted to be a mom. And so I was
Mm,
like, that's going to be my priority. And I don't want to be on call all the time. And,
yeah.
so it was kind of weighing, those options. And then I also didn't want to be, responsible for making those like life and death decisions. And
Mm,
that just wasn't for me. And so I was
yeah.
like, okay, that's not for me. So what can I do that is still kind of in that realm? And I did
Yeah.
want to also be a physical therapist. And then I realized that they had a specialty in pelvic health. And I was
Mm,
like, that's it. Like,
yeah.
yeah.
Yeah. And I mean, you still can treat like sexual problems too. Yeah.
Yeah. Actually, one of my favorite things to treat is sexual dysfunction.
Yes.
I love it. That, and
Yeah.
then of course, those with a history of trauma, I do also like working with them as well. Yeah.
Mm. Yeah. And if you're questioning, anyone listening is questioning, why would that be so fun treating sexual dysfunction? Because it's amazing when people have never experienced like pleasure in intercourse. It is amazing to see the changes because you should be able to experience pleasure when you're having sex, when you're having intercourse. And if you're not, something is wrong. And it may be
Mhm.
physical, it may be something mental health, emotional. Yes. So I also like working with people who are, struggling in the bedroom too.
Yeah. It's just such a big part of life, and
Hmm.
if you're not enjoying that aspect, if you're wanting to, right? If you have the desire to and you're not
Yeah.
able to, that's a problem. It can really cause a lot of issues mentally if that's something that
Yeah.
you're wanting to partake in and you can't.
Yeah.
Yeah. Mm. So I will say too, we do like to see people that deal with infertility and
Okay.
some of that could be from like endometriosis or PCOS.
Mm.
can do
Okay.
some manual technique to address that. But also what some people don't, I mean, the people going through it know, but a lot of
Yeah.
people don't realize that there are also people out there that would love to have a baby, but they just
Hmm.
can't because intercourse is so painful that they can't
Yeah.
tolerate that. And so love working with people like that as well.
Yeah. So if you're listening and you are having pain during intercourse, please go seek out help from a pelvic floor therapist because again, like sex should be pleasurable, intercourse should be pleasurable, and it should not be something that you dread.
Exactly. Yeah, it should not feel like a job. It should be enjoyable.
Yeah.
For
And if sex feels like a job and it does feel good when you have it, then maybe you should seek out a therapist to help you with that part.
I will that, I will say a lot of, we treat, and this goes for anything, not just painful intercourse. It could be that they're dealing with, urinary urgency, frequency, bladder
Yeah.
leakage, constipation. A lot of those things actually lend more to a tight and hyperactive pelvic floor. Going
Oh,
back to what I said at the beginning, you think,
yeah.
oh, just do your Kegels and you'll be fine. And that's not true. I would say the vast
Mm,
majority of the people that I see, I think most PTs could say this, most pelvic PTs could say this,
mhm.
um, that they are actually dealing with more hyperactivity, more tension, more tightness in the pelvic floor as opposed to straight
Okay.
weakness. So
Mm,
and where does that come from? A lot of times it's personality. I say this to almost all my patients. I hate stereotyping, right? Anything, but I feel
yeah.
like some pelvic floor dysfunction I can stereotype a little bit. So I see a lot of like personality, like type A personality, dealing with a history of trauma, anxiety, depression, people who just tend to hold tension. And so I like to say if you're a jaw clencher, your pelvic
Yeah.
floor is also a clencher. Yeah.
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 And if you notice that your jaw is clenched now, use this opportunity to relax those muscles. Yeah.
And so my point there was I almost always have the discussion with my patients. Are you seeing somebody? Are you talking with somebody about managing your stress, about finding balance, right? Finding
Yeah.
ways to relax. And have you dealt with that? I've had patients that are like, I think you're right. Like I
Mhm.
do have a history of trauma and I didn't realize how much it was impacting me until I
Yeah.
came here and I realized, oh wow, yeah, this is when this all started. And I just didn't realize that that's what was happening.
Yeah. Yeah.
And so I love co-treating with therapists because if you don't fix what's going on up here, we are
Hmm.
never going to fix what's going on down there
Yeah.
because it's a huge mind-body connection. We can throw literally every tool we have at the pelvic floor and the body, but if we're not addressing the underlying issue, which is whatever
Hmm.
you're going through, we're
Yeah.
never going to get where we want to be.
Hmm.
Yeah.
Yeah. I love that you said that. Like, the physical part, the tension in your physical body is not going to go anywhere until you release the emotional tension within yourself.
Right.
Yeah.
Because going back to even just the talk we were having earlier about therapy, you kind of develop these patterns and it takes time and
Yeah.
effort and thought, basically lifestyle change in order
Hmm.
to break the cycle. Right. And
It
so
is.
having someone to support you through that is so important because again, it can get pretty chaotic up in here.
It can. Yeah. Especially if you're someone struggling with anxiety, like your thoughts will run.
Yeah. We'll
And
take
so
over.
like figuring out how to manage those is going to be really helpful.
Yeah. Yeah. So
Yeah. But I appreciate you coming on. Is there anything else like you feel that, especially around the pelvic floor, that women should look out for or pay attention to, or any other maybe myths that people say, oh no, that's normal, that aren't actually normal?
yeah, I'm trying to think. I feel like we touched on a lot of the big ones.
Hmm.
Um, again, going back to Kegels, Kegels are not always the answer. Most of the time, you need to relax your pelvic floor as
Okay.
opposed to contract. So I would say a
Mm.
lot of times I'm like, I don't even prescribe Kegels to a lot of my,
Okay.
it's
Yeah.
more a lot of down training and relaxation. But as far as
Mm.
like myths, I don't know. I think
Okay.
This is about moms. Yeah. Okay, never mind. I was going to talk about like some of the men stuff, but we're not going there.
Okay. Well, I mean, we can a little bit if any moms and women on here notice something in their husband, they can be like, hey, maybe you
Yeah.
should go see a pelvic floor therapist.
So yeah, I was gonna say we do also treat men. I can't say that about Origin as a whole, right? They're
Okay.
targeting women, but at least here in San Antonio, myself and Rebecca, we both treat men. And
Okay.
so I would say like for them, constipation, pelvic pain, men have all the same issues that women can have too. Urinary issues, whether that be they
Mm.
can't empty their bladder all the way or they're leaking.
Oh,
Yeah.
yeah.
And another big one is like erectile dysfunction. And so
Okay.
I was actually talking with a nurse practitioner the other day who does hormonal replacement therapy. And she was talking to me. She's like, I have this really young guy. His T
Mhm.
levels, they look really good, but I don't know like what he's going through. He says his desire's there and his T levels look great, but like halfway
Yeah.
through, he loses his erection. And I'm like, okay,
Mm.
to me, that sounds like it could be muscular or, maybe he
Okay.
has an endurance issue. And so that's definitely things that like we would love to address too. But going back to women and myths, I think the GI system is really
Mhm.
underplayed. A lot of the things that we experience, like the gas, the constipation, the
Mhm.
straining, feeling like you have to strain to have a bowel movement is not normal. Feeling
Okay.
like you have to strain to empty your bladder, not normal. Going to the bathroom 15 to 20 times a day, not normal. Waking up in the middle of the night, unless you're pregnant or you have a toddler, right, or a baby that you're
Yeah.
caring for, not normal to wake up in the middle of the night to urinate.
Mm.
If
What
you're,
would be like normal in terms of the amount of times people wake up? Because I know that that is a big one that people are like, oh, well, I'm getting older and now I have to wake up this many times
yeah,
a night.
I would say there's a statistic. I don't remember the exact age, but it's over like probably 50 years old, 45 to 50. I think we allow one time. Like one time can be considered normal, but typically
Oh,
when you're young and you're healthy, your bladder can hold a lot unless you're chugging like two whole bottles of water before bed. Okay, sure. Like you're
okay.
gonna get up and go to the bathroom. But if you're like
Wow.
steadily drinking water and
Yeah.
sleeping well, like you should be able to go through the night without having to get up.
Wow. I bet I am like almost 100% positive everyone that is listening to this mind is being blown right now. Because they like you hear those things are like, oh, well, it's really common to get up three times a night after you're this age or and
Yep.
then it's not like
Right.
we should be able to hold it until we get up in the morning.
And of course, there's other factors, right, at play. That's a generalization, and not
Yeah.
everyone falls into a general category. But there's usually other things going on too. But for the most part, yeah, if you're waking up
Yeah.
3, 4, 5 times a night, like let's address that because first of all,
Mhm.
it's affecting your sleep, it's affecting your mood, it's affecting everything really
Yeah.
during your day. Yeah.
Yeah, it does. Because then you wake up and you're like, oh, I'm so tired because I had to wake up three times to pee. Yeah.
Hmm. Yeah.
Wow. That's awesome. I mean, it's not awesome, but it's just like all this information is so helpful. And I am like, I'm sure someone listening to this needed to hear it and is going to be reaching out to a pelvic floor therapist because they didn't know that what they're experiencing isn't normal.
Right. Yeah. And like I hear a lot of times too with like urinary urgency frequency,
Mm,
people don't go on road trips. Because they're like, oh, I'll have to stop a bunch of times to go to the
yeah.
bathroom. Okay, well, that's not normal either. You should be able to, depending on again how much fluid
Mm,
you're drinking, go anywhere between 2 to 4 to 5 hours,
mhm.
again, depending on the amount of
Yeah.
fluid. But yes, you should be able to hold, especially situationally, right? You should be able to dampen
Yeah.
the urge a little bit to get to wherever you're going. So if you're feeling like you get the urge and you're having to sprint to the bathroom or else you're going to leak, not normal, right? Like you should
Mm,
be able to
yeah.
dampen that enough to get you to a bathroom within 15 minutes or so, right? Not like right now.
Yeah. Yeah.
Yeah.
Wow. But thank you so much, Brooke. This was awesome. This, like
Yeah.
all the information you gave, I appreciate you taking the time to come on and chatting with us and educating us on both like your experience becoming a mom and then also your experience as a pelvic floor therapist.
Yeah. Yeah. You're welcome. Thank you so much for having me. It was good. And again, I love to educate. So if you or anyone ever has any questions, definitely don't hesitate to reach out.
Okay. And what's the best way? So like if someone's in San Antonio or maybe they just have a question about origin, what's the
Mhm.
best way to contact you?
So we do have a phone number that they can call, or they can go on the website. Like we have a really great website with a ton of even free resources. There's also a quiz on there. So if you're like unsure if pelvic floor therapy is
Yeah.
for you, you can take the quiz, answer the symptom questions, and based on how you
Mm,
answer, it'll ask you more questions and determine whether
okay.
you're a candidate. But as far as like getting scheduled, we can
Mhm.
put this in the show notes as well. The phone number
Okay.
that they would call seven two
Yeah.
six 268 4459. And then the website is theoriginway.com. So they can schedule online or they can call to get scheduled. And
Okay, yeah. We'll definitely put that in the show notes. So if you're driving, don't try and write this down. You can
yeah.
find it later.
And
Yeah.
so they can also, what was I going to say? It had to do with, oh, we have bios online too. So I know
Mm,
that pelvic floor therapy can be a little taboo and people are unsure, right? They're like, that
yeah.
sounds really intimate. I don't know if I'm comfortable with that. You can go online to the San Antonio page. Rebecca and I both have a bio on there. That goes for all the locations, not just San Antonio. But you can go on there, scroll to the bottom, and it'll show the therapists and a little bit about them. So sometimes that's
Mm,
helpful for
yeah.
people to kind of connect and know who they're going to be working with. And then they also have a helpful like FAQ page. So if you're wondering what to expect or,
Yeah.
like any of that stuff, that's always really helpful as well.
Awesome. Well, thank you so much again. And I hope you have a good rest of your day, Brooke.
Thank you.